Their own words would suggest a merger between CVS, the drugstore retailer that also operates walk-in clinics, and a pharmacy benefit manager, and Aetna, the nation's third-largest insurer, could the beginning of falling healthcare costs. We are talking with CVS, who has 9,000 stores within 3 miles of 80% of the American public, Bertolini said at a Fortune magazine event this spring. Should CVS be in the business of seasonal items or DME? Why can't they be first stop outside the home in the community for health care when they are right around the corner? He added that people see their pharmacist a lot more than they see their doctor. Speaking at Newspulse Finance's All Markets Summit in late October, Aetna's CEO made a case for why the U.S. healthcare delivery system is broken. He pointed out that the U.S. spends the most on healthcare among the OECD nations, but still falls behind. When you add together our healthcare spend and our social spend, we are now 11th among the OECD nations. We are the only nation that spends more than 40% on healthcare, Bertolini said. The rest of the nations spend less than 40% on healthcare. The United States spends 62%. Our lack of investment in social determinants of health has led to a ranking of we are number 34 out of 34 in the OECD nations from the standpoint of value. So this is a value problem. At the moment, the U.S. healthcare system is focused on waiting until people are broken to fix them. That's not working. As a result, Bertolini thinks the definition of health needs to be redefined. To achieve this, thinking about health needs to be moved from the exam table to the kitchen table, according to Bertolini. In other words, they have to get into the home. At a breakfast hosted by the Economic Club of New York in early October, CVS CEO Larry Merlo also made a case of how the pharmacist could play a more active role. There is tremendous opportunity to make healthcare much more effective by engaging with patients more frequently where they are in coordinating care to make a complex system much easier to navigate, Merlo said. He went on to cite some jarring statistics about healthcare costs. About half of the U.S. population has a chronic illness, with more than 80% of all healthcare spending going toward treating those illnesses. Ineffective management of chronic illness and medications associated with those diseases has resulted in more than $300 billion in avoidable costs, according to Merlo. Merlo added that half of the patients don't take medicine as prescribed and up to 1/3 of prescriptions written don't get filled.